President Biden today announced multiple measures to combat spiking COVID-19 infections. The Biden administration plans to use federal leverage to strongly urge nursing homes and other healthcare facilities to vaccinate their staffs fully. Biden has given healthcare facilities notice that federal regulations are being developed to link their Medicaid and Medicare eligibility to their employee vaccination rates. President Biden will also lean on Department of Education's Civil Rights Enforcement Authority to prevent states from banning classroom mask mandates. During Biden's address, he also announced that his administration would begin to offer booster shots beginning September 20th. The announcement comes as the CDC has released data that attribute 98% of new COVID infections to the Delta variant. Booster shots may be especially imperative for Black America, as medical professionals believe that workplace or environmental infections may be the most significant cause of COVID-19 cases in the Black community. Many health professionals believe that Black workers are more likely to be exposed to COVID since Black people mostly hold frontline positions in the workplace as a community. A study conducted by the Foundation for AIDS Research has found that Black counties, as employment rates increased over the past 2 years, COVID rates decreased. Joining us to discuss how the workplace has become the biggest threat facing the Black community and the misconceptions regarding COVID infections and Black people is Director, Maryland Center of Health Equality, Dr. Stephen Thomas. Dr. Thomas, you know, I was reading this story on NOLA.com and out of New Orleans about how cases in Louisiana were distributed across race and age. And one of the things that struck me most was that the younger the person was, the more out of whack, out of balance that the COVID rates were for Black people over white people. But once you hit age 65, there was no difference whatsoever in these deaths, which kind of blew a hole to me in the notion that it was all about comorbidities. In fact, what these researchers were saying was that it may very well be more about work.
Well, first of all, thank you very much for allowing me to come on your show and talk to your audience about this important topic. I think it absolutely has to do with work. Think about it. We've been through this pandemic, and my garbage has been picked up every day. I've seen the buses rolling down the streets every day, even if they don't have people on them. So our people are exposed. Our people, Black people, are in jobs, essential, that put them out and exposed them to the virus when it was circulating, even before we knew how devastating it was. And then once we knew how devastating it was, guess what? Our people were still going to work, in many cases under conditions where they did not have the protection that they needed to protect themselves from COVID. That's all changed now. We now have a vaccine. That's a game changer.
Yes, if only people will take it, right? So we still have disproportionate rates of vaccine administration. People who are Black are just not getting the vaccine at the same rate as white people and other racial groups. What do we do to move that?
Well, you know, at the end of the day, it's all about trust. And this is why I'm so happy to be here on your network, where people can get information they can trust. And we believe when they get that information and have the knowledge they need, they will naturally gravitate towards saving their own lives. But Charles, here's what's happening. Our communities are being marinated in misinformation. And that's happened since the announcement of the virus and the pandemic coming to American shores from the very beginning. And here's the game changer as well. We have an entire broadcast network telling people not to be vaccinated, telling people it's a hoax. We got work to do. And 4 years of a constant stream of misinformation is not going to be erased in 7 months. So I say, let's go where Black people already have trust. And one of the things that we have done is launched a campaign in Black barbershops and beauty salons. It's called HAIR, Health Advocates in Reach and Research. For the past 15 years, we've been doing research on the role that Black barbers and stylists can play, addressing the underlying conditions, you know, those obesity, diabetes, heart disease, all those underlying conditions, they're still there now and they'll be there after this surge. I hope that our black barbershops and beauty salons can be a new home for healthcare. And now the hair program has been embraced by the White House in a program called Shots at the Shop. We have now over 1,000 barbershops and beauty salons across the United States enrolled in this program. It's amazing.
So one last question, getting back to this idea of relationship to work and COVID exposure. Many of the jobs that people now say they can't find people to fill are those very same jobs that would put people back into close contact with other people, right? So are people being smarter if they're not rushing back into these jobs where they're going to be up against other human beings who may be infected with this virus?
I am telling you, black people know other black folks who have suffered from this disease. The 600,000 plus people who have died, many of them are black. Okay? And so you are literally putting your life in your hands to go to that low wage job if they're not protecting you. So if businesses are going to have you come back to work, they have an obligation and responsibility to make sure you're protected. And that means respiratory protection, not just a face covering or a mask. We're talking about N95 protection because of the virulence of this Delta virus. So let's be smart, black people. We must save ourselves and make sure that we have the right information to make the decisions we need to protect ourselves and our loved ones. It's about our community. Right now, we're at a critical moment, Charles, a critical moment in this pandemic.
Mm-hmm. Dr. Thomas, or maybe I should say DJ Dr. Thomas with that fancy microphone setup you have there. Thank you so much for your time tonight, sir. I really appreciate it. Another massive voting rights power grab is underway in Georgia. That story next on Prime.